Hello, my name is Seth. I'll be your nurse practitioner today. We're going to do a cardiac workup, if that's okay, cardiac exam. Do you consent to me filming this and putting it on YouTube for my instructor to grade?
I consent.
Awesome, thanks. I'm going to enter the room, wash my hands, perform hand hygiene. We're going to take blood pressure in both arms. First sitting and then supine, completely flat. We're going to take blood pressure sitting, both arms, and lying, both arms. And we're going to do this to compare these findings, checking for orthostatic changes in your blood pressure, reduced blood flow due to peripheral or vascular disease, things like that. Next, we're going to raise your head to 30 to 45 degrees as it is now. We're going to go ahead and measure our jugular venous pressure. And we do this by having you turn your head to the left just a hair. And we're going to find the pulsations of the external jugular vein, which is right about here. The vein isn't actually pulsating, it's being pushed by the carotid arteries that are beneath it, but we're looking for the pulsations, which ends right about here, perfectly fine. And then we're going to take a piece of paper and we're going to measure from where we see the pulsations ending, the most superior part, and we're going to measure to the sternal angle, which is right about here. And then we're going to take our centimeter stick and we're going to measure the depth of that. And as you can see, this is right at 2, maybe 1.9, closer to 2 centimeters. And that is anything below 3 centimeters is perfectly normal. So that's good. We would add 5 centimeters to that since the aorta is actually lower, and that gives us a reading of 7 JVP. But anyways, now that we've done that, we're going to take a look at your carotids. I'm just going to inspect the neck here. Trachea looks good, no deviation. We're going to palpate the carotid arteries. You may have to move this mastoid muscle out of the way to feel them. You don't want to palpate at the same time. Could reduce blood flow to the head. But this is +2 regular and strong pulse here on the left side and +2 regular strong on the right side. Next, we would auscultate the jugular or the carotids with the bell and diaphragm, both sides. Listening for murmurs, bruits, things of that nature. Everything seems healthy. No turbulence. All right. Now that we've inspected the neck, we're going to inspect the thorax and chest. In a male patient, I would probably have you take your shirt off. A female, if you're wearing a sports bra or a bra, we could still expose the chest because I want to get a good look at it, but for this exam, we'll just leave your shirt alone for obvious reasons. But when we look at the chest, we're looking at the sternum. We're making sure that it is straight and midline. We're looking for concaveness, convection in the chest. We're going to make sure that there's no abnormal movements. I don't see any pulsations. There's no apical impulse pulsations. I don't see any precordial pulsations. These are abnormal findings. We're looking for even chest rise and fall, just secondary to your respirations. We're going to go ahead and palpate the point of maximal impulse, which is located just over the mitral area. On the male patient, it could be just below the left nipple. It would be normal to feel that pulse right in this area in the fourth, fifth intercostal. This is at the apex of the heart, and you can just barely feel that pushing up against your fingertips, which is normal and good. Next, after we've inspected, we're going to go ahead and listen to your heart sounds. We would start with the apical pulse. We're going to listen to your apical heart sound, which is the second intercostal right sternal border. We're going to use bell and diaphragm. We're listening to the pulmonic heart sound, which is the apical is right, second intercostal. The pulmonic is left sternal border, second intercostal, bell and diaphragm. And then we're going to check your Erb's point, which is the third intercostal, left sternal border, bell and diaphragm. We're then going to move down to the tricuspid, which is the fourth intercostal, left sternal border, bell and diaphragm. And then lastly, the mitral valve, which is the fifth intercostal, left midclavicular line, bell and diaphragm. And we're listening for a normal S1 and S2, which is the aortic and pulmonic valves closing, which is normal. Sometimes you may hear a S3 or S4, which are abnormal. One way to hear an S3 would be, or splitting, would be to have you inhale deeply, and I could auscultate at that Erb's point, and the pressure in the lungs sometimes forces the S2 to close at inappropriate times. So you'll hear a little third heartbeat due to the pressure in the lungs from that deep breath that you just took. But all of yours sound perfectly normal. I hear S1 and S2 and all 5 heart sound locations, so this is a very good finding. Next, we want to check out the abdominal aorta, and the abdominal aorta can be palpated just a couple of centimeters superior to the umbilicus, to the left side of it, and we would use both of our hands. We would feel down in there. The normal aorta is less than 3 centimeters on palpation. And this feels perfectly fine to me. After we've palpated that, we're going to auscultate. We're listening for turbulence, any type of turbulent, abnormal sounds, murmurs, bruits, things like that. You doing okay? All right. While we're here, we're going to go ahead and look at the femoral arteries, which are kind of in the groin area. You have one here and one here. We're going to palpate these, +2. They sound perfect. They feel normal. +2, steady, strong. We would auscultate these with bell and diaphragm for the same reason we listen to all your other veins or arteries, I should say. But we checked for precordial pulsations, apical impulse pulsations, your point of maximal impulse. Everything is seems healthy. Next, we're going to inspect the extremities, all 4 of them. We're going to look at your arms and legs. We're looking for rashes, cellulitis, edema, varicose veins, any shunts. I also want to mention, when we were looking at your chest, I missed that earlier, we'd go back and I want to palpate for lifts, leaves, and heaves, which are just abnormal findings, and this is related to movement of your chest and thorax that is not related to breathing, so these would not be good. But you didn't have it just now. But as we go back to the extremities, no edema, cellulitis, varicose veins, shunts. The color looks good. They're nice and warm, not diaphoretic, so this is all great. We're going to go ahead and palpate bilaterally. I'm just going to do the right side for convenience sake. Your bilateral radial pulses, +2, strong, steady. Feels good. We're going to feel the brachial pulse, which is right in here. This is really useful for babies. You can't really feel their carotids, and sometimes they're a little too chubby in the wrists. So you can feel their brachials pretty good on newborns and such. We've already palpated the femorals. Next, we'll do the popliteal, which is just behind the patella here. And you bend the knee and feel back here with both hands, and I can kind of feel that popliteal. +2, steady and strong, feels good. Next, we're going to straighten your leg back out and feel your dorsalis pedis, which is just here on the dorsal surface of the foot, and the posterior tibialis. And we are feeling for all of these arteries, all of these pulse locations bilaterally. So same thing we do to the right, we do to the left. Dorsalis pedis, posterior tibialis, popliteal, brachial, radial, and there's an ulnar pulse if we wanted to, and the femorals. And the final portion of our cardiovascular exam is we want to take a look at your nails. We're checking the capri fill. Normal capri fill is about 2 seconds or less. We just press on this, blanch it, let it go. It turns nice and pink or red again. That's a good sign. We're looking for clubbing, which would be secondary to COPD or long-term orthopnea. We're looking for cyanosis. The color looks good. Looking clubbing. Looking for splinter hemorrhages in all 10 fingers and all 10 toes. Any questions? Everything seems healthy for my exam. Thank you so much.
Thank you.
Of course.